Hello, my name is Stephen McCulley. I'm a consultant plastic and reconstructive surgeon, and I have a special interest in breast cancer surgery and breast cancer reconstruction. I'd like to talk to you about the latissimus dorsi or LD flap for breast reconstruction. This involves using the latissimus dorsi muscle, which is the back muscle, and then a variable amount of skin and fat overlying that muscle to help build a breast. It's what we call a pedicle flap. In other words, that just means we leave it attached, so the muscle is left attached to the body and it's brought through the armpit area into the breast area. There are essentially two ways of using the LD flap. The first is by itself, and that's called the extended LD flap. It's called extended because we take additional fat on top of the muscle and we try and build the whole breast out of just your own body tissue, so the muscle, the fat and the skin from the back. That has the advantage of leaving a much softer breast and has all the other advantages that using your own body tissue from elsewhere. In other words, it's a breast that doesn't have any implant within it, therefore it doesn't have any potential risk of hardening around an implant, and as a general rule tends to give a softer breast with a little bit more natural movement within it. However, probably more commonly the LD flap is used in conjunction with an implant, so therefore you have the same scar on your back, but you have an implant to add to the volume. And that is required when there isn't enough volume on the back to do the extended LD flap. The operation takes between 3 and 4 hours. You'll need between 3 and 5 days in hospital, and you would take at least sort of 6 to 8 weeks to fully get over this, and possibly even slightly longer. You do have a bit of stiffness in your shoulder to begin with, and there are other potential risks of bleeding, infection, variable scarring, wound healing problems, a very small risk of flap failure, but that's less than 0.5%. But overall this is a very sort of routine and consistent operation that can give some very pleasing results. Other downsides is you can end up with a little bit of a wound healing problem on the back or some fluid collections on the back, and that's actually quite common, particularly with the extended LD flap. Whichever method of reconstruction you're deciding to choose, I wish you all the very best with your decision making.